To February, and it's Monday, we want people to keep in mind this American Heart Month that you should know your numbers, meaning blood pressure, cholesterol, glucose. And family medicine doctor Eunice Sanchez Mata is here to talk about it. So thanks from Sharp Reese Steely. Thanks for being with us.
Thank you.
Yeah, so this is something that's important. You know, all month we've been trying to raise awareness. And this morning we're talking in particular about numbers. What are we talking about specifically?
Well, we're talking about blood pressure. You know, knowing what your blood pressure is, cholesterol levels, glucose, which is also known as sugar, knowing what your weight is. You'd be surprised, but a lot of people just don't weigh themselves. And so those are risk factors for cardiovascular disease, which is the #1 killer in our country, right? There's more deaths due to heart disease than all cancers combined.
And then you think about how people just don't want to know. They think, if I don't know, then nothing's going to happen. But you really should get on top of this.
Absolutely. You know, especially like blood pressure. Hypertension is known as the silent killer. And so most people don't have symptoms until whether it's a heart attack or stroke or something really, really bad. So you really do need to know those numbers and know what your risk factors are, what your family history is, and, you know, where you are in that risk category.
And so what about how the number, we're still talking about numbers, how often should we be evaluated or check these?
You know, nowadays it's very easy to check your blood pressure. So if you have normal blood pressure,
you have something on the table right here.
You can check that at any local pharmacy. Those are very easy to check. So at least once a year. Cholesterol levels, it depends on your age, and it also depends on your family history and risk factors. If you're a smoker, if you're more, you know, overweight or obese, those are the numbers that you probably need to be checking a little bit more frequently. And
everybody has different circumstances, right? So you can sort of, if people get on top of this, you can tailor something specific for each person.
You can, and that's why it's so important to establish care with a primary health provider, to know what those risks are, know the frequency of monitoring that is specific to you.
You know, I have the history of heart disease on my father's side of the family. He died when I was young, and his father did as well. And so, you know, they just didn't have that kind of information. Had it been today, maybe the circumstances would have been different.
Absolutely. A lot of these diseases are preventable diseases. And so knowing your numbers is really, really important. I think you have to take ownership and responsibility for that. So, you know, contact your health provider and make an appointment and talk to them about those risks and where you fall in that category.
How can people get more information if they have more questions?
Well, I mean, certainly contacting your physician's office and making an appointment, or going to sharp.com. You know, it's a great resource. The American Heart Association has lots of information on heart disease and prevention and programs and, you know, just ways to become healthier.
All right. Dr. Sanchez Mata, thank you so much for being with us.
Thank you.
Have a great day.